So thank you everybody for coming. My name is Kelly Gluckman. This is an ongoing series concerning HIV and topics related to HIV. This is brought to you by brightbod.com. And this is my personal experience. It is not intended to be medical advice. We are going to silence the microphones for about 20 to 25 minutes while I do my presentation, and then I'll open up the floor for questions afterwards. Please feel free to ask any and all questions you have. I will answer them all to the best of my ability, or I'll point you in the right direction. If you have questions after, feel free to go to brightbod.com and you can take video of yourself asking a question and someone will respond on video. So yeah, if you have any questions afterward, if they pop up, then feel free to go to brightbod.com. Today I'm going to talk about what you do if you're just diagnosed with HIV and you don't have insurance. That is my concerned eagle. I thought he was cute and funny. I like pictures and I like to laugh, so you're going to see a lot of that. First and foremost, keep calm. Most likely at diagnosis, you will be assigned a peer support advocate or a caseworker. If not, then this presentation is going to be easy steps to take in order to find care. I was not assigned a peer support advocate, and I'll tell my story in a little bit. I thought this was funny. I smile to hide how completely overwhelmed I am. It's very easy to feel overwhelmed by an HIV diagnosis. So today we're going to talk about me, how I navigated the medical field when I was first diagnosed. I don't have insurance. Can I get myself into care? What services are available to me? How do I find a provider in my area? And how do I find a support group? So first I'm going to talk about myself a bit. I have been HIV positive for 6 years. I was diagnosed on October 25th, 2010. I was diagnosed at Planned Parenthood, and I wanted to get out of there so quickly that I didn't ask them about any services. They gave me a piece of paper with information about clinics in my area, and they said, call us if you have any questions, but I didn't. This is me on November 8th. I was diagnosed October 25th. So this is me November 8th. This is also me November 8th. So after I left Planned Parenthood, I just had this piece of paper with a list of clinics. And the first one was the Venice Family Clinic. So I just walked in. I didn't make a call ahead of time. I looked up their hours. I think I'm like any other millennial, and we don't like making phone calls. And I think that's like a thing right now for people, is like making phone calls is just not something we like to do. I'm going to be telling you to make phone calls. I wish that I had made phone calls before I did this, because the Venice Family Clinic turned me away because I made too much money. It was a free clinic for people who are of very low income, and I brought my financial information, and along with my boyfriend at the time, we had gotten diagnosed with HIV together, and I made too much money for the both of us. So it was a very, very, very low income clinic, and so after that, I kind of didn't know what to do. I had heard about the LGBT Center in West Hollywood, which is close to me in Los Angeles. And so I called them and got myself an appointment to come in. And that's where I got care. And they kind of walked me through everything. Most places will be really good with you, and they will quite literally walk you through everything. Yeah, as long as you get yourself to a place of care, they will pretty much take care of the rest. But what I'm going to present to you is kind of like assuming that nobody helps you with anything. Yeah, just just in case you happen to find yourself in a place where you're not really getting much help. So the services that are provided to us are under the Ryan White program. So the Ryan White program is a government subsidy that provides care for people who are living with HIV. The eligibility requirements are you must have been diagnosed with HIV or AIDS to be considered low income or have either no health insurance or your insurance does not pay for the care you need. So this program is in place specifically for people who are kind of in between the cracks of our medical system. This Ryan White program is pretty comprehensive. These are the services that are provided. Take inventory of these services. I'm going to leave this up for a few minutes. The AIDS Drug Assistance Program at the top there, that provides our medicine, early intervention services. I'm not 100% about that. I think that's like a case manager or a peer support advocate. The AIDS pharmaceutical assistance is with your medications, health insurance premium and cost sharing assistance for low-income individuals, home and community-based health services, home health care, hospice services, medical nutrition therapy. Medical nutrition therapy is like vitamins, minerals, and also like a nutritionist to talk you through your food intake and how to be healthy. The Ryan White program is pretty amazing. It's pretty wonderful. The government realized that getting people who are HIV positive into care is best for everybody, because once we are in care, that means that we are no longer in fact to take care of fewer people. So you can get oral health care, which is obviously the dentist, outpatient ambulatory health services, substance abuse outpatient care. So if you're having problems with drugs or alcohol, child care services, emergency financial assistance. So that's cash, food bank, home delivered meals, health, education, and risk reduction, goal transportation. So that's like a car to and from your appointments. Non-medical case management services, outreach services, professional services. So that's like job placement. So once you get yourself into care, you're going to want to ask your care provider about all these services and how to access these services. That website up in the top left corner is the best place to go to get more information about the Ryan White program. So how do I get myself into the Ryan White program? How do you get there? Step one, you're going to want to make a call. That's a cute baby. I cracked myself up. So once again, this is one of the links underneath that last website that I just sent you to. This is the website you go to. They're HIV and AIDS hotlines. So they have a hotline for each and every single state in the U.S. They have one, you see for Alaska, they have for Hawaii, they have, I believe even Puerto Rico. So you can get on the phone and talk to someone and get yourself help through one of these hotlines if you don't have any other information. This is just a screenshot. Otherwise, I would scroll down. I tried to, go through a website the last time, but I'm technologically challenged. So the screen sharing thing, I'm still trying to figure out. So I just took a screenshot. But yeah, if you hop on the phone, you can get information about a clinic near you through this website. Or you can use this website. This is very comprehensive. This is actually my favorite resource for finding care. So when you sign into this website, it will locate you for you. You turn on your location services and it'll find free HIV care and testing within 15 miles of your location. So in the top right, Gardenia Residential Building, that's where I am in Los Angeles. And then on the right, you see the different icons for what kind of care these places provide. What you're going to want to do is click the Ryan White HIV care button, because those are the places that cover you under Ryan White. So this is another screenshot of I opened up the Ryan White HIV care link, and I clicked the University of California one. And when you click one of those icons, it'll come up with the location, the telephone number. You can get directions. We live in the age of technology. It's really cool. And this is the best locator in my opinion, just because you have the location right in front of you and you can map it. So you can use this to get a hotline if you want to talk to another human being. But if you want to kind of see exactly where you're going, this is my favorite resource for finding where to go. So what to say and questions to ask when you first get on the phone with somebody. You'll pick up the phone and it'll probably start off with like an automated service. So it'll say something like, if you are a hospital, or if this is an emergency, press 911. If you are a doctor or hospital, press 2. If you are a patient, press 3. So you're going to want to press whatever number corresponds with patient or asking for appointments. You can even hit the 0. If you hit 0, most automated phone systems will send you right to an operator. So if you're not finding the option for you, just hit 0. You want to say, hi, my name is Kelly. I was just diagnosed with HIV. I don't have health insurance and I make this much money per month. Can you help me? The reason why I put in, I make so much money per month, can you help me, is because of what I went through. The Venice Family Clinic didn't want to take me because I made too much money. And if I would have made a call and asked that question, I wouldn't have had to go through that. So I recommend that. And also the Ryan White, hold on, I forgot to say something about the Ryan White program. Front row. Okay. So underneath the eligibility requirements for the Ryan White program, be considered low income. It changes per state. So each state is different and it's on a sliding scale. So depending on how much money you make, is how much coverage you get, and it's all very affordable. Forgot to say that. So the next question you're going to want to ask is, when can I schedule an appointment? What should I bring to my first appointment? Because different places are going to have different requirements. Some places are going to want you to have proof of where you live, proof of identification and your citizen status. And some places are going to want like your tax returns, from last year, or your last 3 pay stubs. Ask them what you should bring to your first appointment. So what happens next? You can ask them that too. But you will be brought in for a financial screening and a confirmation HIV test. So they're going to test you one more time just to make sure that your first HIV test wasn't a false positive. And they're also going to take your blood and look at where the virus is in its in your infection status. So how much of the virus is in your blood, and whether you happen to be in AIDS territory. A lot of people don't get tested until it's an emergency and their T cells are depleted. So they'll take a confirmation HIV test and they'll see how much of an emergency it is to get you into care. But more than likely, they'll get you into care pretty quickly if, once your HIV is confirmed. Then they'll schedule you an appointment with a doctor. Ask the person who does your financial screening about any services that you might need that you see are offered under the Ryan White program. So you can go back to that website that I showed you and look at all of those services that are provided. And anything that you see that you might need, you're going to want to talk to that AIDS service organization about. The AIDS service organizations are they're very thorough, they're very compassionate, and they're very helpful. So once you get into a facility, you have all these resources at your fingertips. And if they personally do not provide that service, they can help connect you to a place that does. Do not be afraid to ask questions, because they're there to help you. And ASO stands for AIDS Service Organization. So many AIDS service organizations will have travel services if needed in order for you to get to your appointments, if that's an issue. So that's something that you definitely want to ask them about if you don't have a car. I know in Los Angeles, the transportation system isn't super fantastic. And I've been to other states where you kind of need a car to get around, and some AIDS service organizations are far. So make sure if you don't have a car, you ask about travel services if they have them. Step 2, if the first person you speak to doesn't have the right information for you, or if you feel that you aren't being treated with respect, make another call. So start from the beginning, find a different location. As you see on the right with Ryan White HIV Care, there are 11 places around me that I can go to for care. You can also call HIV testing sites. If you call HIV testing sites, they'll have more resources as well. Don't be afraid to make calls. Don't be afraid to ask questions. And if you don't like the people, look at Obama. If you don't feel like you're being treated with respect, get a second opinion. Go to a different facility. Some places don't really have very many facilities, but most places in the country will have several, depending on the density of the population in your area. So just because we're HIV positive does not mean that we don't deserve respect and compassionate care. So it's important to like your doctor. And in HIV, diagnosis is very difficult. Take advantage of as many services as you need to get through it. So if you need help with housing, if you need financial services, if you need transportation services, childcare, if you're dealing with addiction and you need help, use these services. And once you're under the umbrella of care of an AIDS service organization, and once you're in the Ryan White program, you have access to all of these services. So talk to the people at your AIDS service organization. They will help connect you. And every year you go through a financial screening process. So they will call you to set up an appointment to have you come in, and once again you'll bring your tax return or your last 3 pay stubs, and they'll do a financial screening to keep you in the Ryan White care program. Lastly, find support. Support is probably the most important part of this journey. You will care behind care, medical care. You want friends who know what you're going through. So reach out to family, reach out to friends. I think you'll find that people are more compassionate than you thought they were going to be. This is what I did. I went to the pause forums, so forums.pause.com, and this is actually my homepage, Kelly Brianna, that's me on the forums, and I clicked to the I Just Tested Pause forum. So you can go through this website, you can talk to other people living with HIV, you can post something if you want to start a discussion. This is a great place to talk to others. This was my favorite resource for getting support was talking to other people who were also living with HIV. In order to get a support group, there isn't a national resource for support groups. So in order to find an actual in-person support group, you're going to want to go to Google and type in HIV support group and then your city, or HIV support group in your state. And if you're a heterosexual male or heterosexual female, a drug user, a gay male, lesbian female, there are support groups that are specific to your demographic as well. It's kind of challenging sometimes finding support groups as heterosexual people, because in our country, the majority of people living with HIV are homosexual, but you can find support groups for whatever your needs are. And if not, use this website. And also, I really like the gay support groups. I think they're really awesome. And they crack me up. And it's like, regardless of someone's identity, it's just really nice to be around someone who knows what you're going through. So, it's a good opportunity to open your heart and mind to other people of other identities, and connect on a human level. Yeah. So forums.pause.com, I highly recommend. What time is it? Oh, 4:22, perfect. So these are my social media. You can feel free to reach out if you have any questions. For Facebook, you're going to want to add the Facebook with that picture, because that is my public profile. I'm not super active on Snapchat. I'm not super active on Twitter, but Facebook and Instagram, you can find me, add me. I'll respond. Happy to answer any questions.
How much money is too much money that you make?
It depends on, and I'll leave this one open. It depends on where you are in the country. So, in California, I believe like $3,900 a month is the cap on your income in order to get Ryan White care. But it varies across the country. But if you get to an AIDS service organization, they don't just connect you to Ryan White programs. They will also connect you to health insurance, just normal health insurance. They'll help you find health insurance. The AIDS service organizations are kind of like, they're agencies that simply connect people to care. Like, all you have to do is make a call and they will pretty much baby you through the next steps. But as far as income is concerned, it varies from state to state.
Ellie, how long has this program been in existence?
The Ryan White Care Program came into existence in the 80s. I'm not sure exactly what year it is. I'm looking it up right now. But it's in the 80s. Ryan White was a young boy who got HIV through, he was a hemophiliac, so he got it through a blood transfusion. And he developed AIDS, and he wanted to go back to school to be a normal kid. And he faced a lot of discrimination going back to school. And his family got really fed up with all the discrimination that was going on. And so they went to the courts, and it was brought all the way to the Supreme Court. I just brought up Ryan White. So Ryan White died in 1990. In 84, he was given six months to live. He was given 6 months to live in 1984, but he lived all the way until April 1990. It was 1 month before his high school graduation. Okay. Let me see.
A state-run program?
It's a federal program, so it's
Federal.
countrywide.
Okay, federal, okay.
Yeah,
Alright.
it's all across the country, and the government budgets each year for the Ryan White program, and this is as it stands right now. We have a Republican Congress and Senate, or a Republican majority Congress and Senate right now. So there are a lot of question marks as to what's going to happen, but there are a lot of people who advocate for this program, and I'm actually going to Washington, D.C. at the end of this month to advocate for this program. So, it's kind of, I don't know what's going to happen, but we have to stay on our representatives, and you can make calls, you can send letters to your representatives. If this affects you, you can make calls, and they have to log the calls. Advocacy is a much different subject, but it's very important.
Kelly,
Yes.
you said that you didn't qualify for the Ryan White program because of your income.
No.
What steps did you take to find the services that you needed? I mean,
okay. No, I did. I was applicable for the Ryan White program.
oh, okay. You were.
I was not applicable for the Venice Family Clinic. So
I see.
Yeah, the clinic itself was a very low income clinic.
Okay.
The Ryan White program works on a sliding scale. So depending on how much money you make is how much money you're gonna have to spend on services. So I happened, at the time I was making about $2,500 a month, and my services were all free. I got myself into medical care, into psychological care, and I used any of the other services. I didn't access housing at the time. That would have been smart. I wish I would have accessed more. I was probably applicable, or I qualified for more programs, but I got myself into medical care and therapy, psychological therapy, and it was free for me, as well as my medication. And at the time, I made $2,500 a month.
Okay.
Kelly,
Yes.
on the news today, they said that they went ahead to repeal the Obamacare, which is the Affordable Care Act.
Right.
Now, people that are on the Affordable Care Act who have AIDS, what's going to happen to them? Do you know?
Yeah. See, when I was first diagnosed with HIV, the Affordable Care Act wasn't in place yet. So I accessed care before Obamacare even existed. I was covered under the Ryan White program. So the Ryan White program is separate from the Affordable Care Act. They are two completely different programs. When the Affordable Care Act came into place, it overtook some of the Ryan White programs, but the Ryan White program itself still exists. It's still completely intact. So what I think is going to happen, if they repeal and replace Obamacare, the Ryan White program is going to kick back in. And I'm going to Washington, D.C. to advocate specifically for the Ryan White program at the end of this month. So that's what I think is going to happen, is that the Ryan White program is just going to take back over what the Affordable Care Act isn't going to cover anymore.
Okay.
It might be a bigger fight than I expect it to be, but there are a lot of people who are HIV positive and very wealthy and very powerful who we don't even know about. And there are a lot of people who care very deeply about HIV and AIDS and making sure that people living with HIV and AIDS are covered. So I'm nervous, but I don't think we're gonna be shit out of luck. But as things progress, if something happens, I can do another webinar and kind of update everybody as to what's going on with that.
Okay, thank you.
Sure.
Kelly, the psychosocial support services, that covers individuals who may be suicidal or depressed. Where would that fall under? Would that be?
Psychosocial support services. I want to say that those are support groups. Psychosocial. The care that I got was psychological therapy. So I got an individual therapist, and they had psychiatrists as well. Psychiatrists are for like if you need medication, like for depression or anxiety or bipolar disorder, or psychiatrists do that stuff, and therapists is talking you through things and having an objective party to listen to you. So pretty much all psychological care is covered under the Ryan White program, including any clinic-run support group.
Okay.
So it is suicide services as well.
Were you suicidal?
No.
I have a question. If somebody, I mean, I guess the question is, how common is it for people to be discouraged after they go to the Ryan White program? I mean, is it realistic to have one set of expectations and not have the Ryan White program satisfy those expectations?
Yeah, I mean, I can't speak for the entire country and how medical providers treat their patients across the country. I do, what I know is what I've experienced. So, and I have friends all across the country who access these services too. Are you talking about like the quality of care or the amount that's covered? Well,
I would be concerned about starting with, let's say, a therapist, and then having the therapist say, well, I can help you for this amount of time, and then afterwards I can't help you anymore. Is that something that they should expect?
It's possible. I was covered for 26 sessions with my therapist. So there are limits to what's covered. And going to the hospital is not covered. That's something that could be of concern to people, because going to the hospital or the emergency room is not covered under this program. So that's one thing. The Ryan White program is pretty awesome, but it's not the end all be all of medical treatment or medical care. There's also Medicare. I feel weird talking about this just because of what's going on in politics right now, because I don't know what's going to happen. Yeah, this is just as it stands right now. But everything is changing very rapidly right now with our Congress.
And how are these services redeemed? Does a person get the money, or does he get a voucher, or does he get, or does he actually go into a Ryan White clinic and get the services there, or does it depend?
I don't believe you get a voucher. Once you get into the doors of an AIDS service organization and they do a financial screening and then have you signed up for the Ryan White program, then you can make appointments and get care. And the place of treatment where you get care, they walk you through everything.
And last question, if you have HIV or AIDS and you also have health insurance, will Ryan White turn you away, or do they not turn away anybody?
You see on the left-hand side, it says one of the eligibility requirements is have either no health insurance or your current health insurance does not pay for the care you need. So if there are cracks in your care that where what you need is slipping through, then the Ryan White program will complement or supplement what your insurance isn't covering. And it is on the basis of income. Right now, with Obamacare, pre-existing conditions are covered. So as of right now, health insurance companies cannot turn you away for living with HIV. And each health insurance is different. PPOs, HMOs, all these different healthcare. And I'm not an expert on healthcare by any stretch of the imagination, but every insurance policy is going to be different.
Thank you.
So Kelly, under the Ryan White program, the AIDS drugs, is there any kind of a cost associated or a copay, or is it all included?
For myself,
Yeah.
I do not pay. I do not pay a penny for my medications, not out of pocket.
Okay.
It depends on how much you make it. If you make more money, they might charge you like a $10 copay. But as of right now, for myself, I haven't paid a penny for my medication since I became HIV positive.
Okay.
Are there any more questions? All right, seems like we're good. So thank you everybody for joining. I hope you have a great week, and I'll see you next week.